This was our annual healthcare conference we do every year. It's put together and staffed by our Louisiana Healthcare Commission, statutorily created by the legislature, 33 members representing consumers, companies, healthcare providers, and they are tasked by the legislature with studying healthcare issues, reporting annually to the legislature, and part of that effort includes this all-day healthcare conference that we do each year. We bring in the best presenters and speakers, experts that we can put our hands on, from state government at DHH to the National Association of Insurance Commissioners to the executives of the major health insurers doing business in our state and others.
I chair the Louisiana Healthcare Commission, and we are commissioned by the legislature to study and review and report back to the legislature on issues having to do with the status of health care in Louisiana. We look at affordability, quality, and access. And this is an extremely interesting year because now since April, the enrollment time has passed for entering into the federal system under the Affordable Care Act. We find that there are over 100,000 people in Louisiana that have signed on to be part of the new healthcare system and the new healthcare market. So I can't wait for this conference to hear some of the impact from both the insurers and the producers, as well as from hearing from the providers, to see what the impact of the Affordable Care Act and the new enrollment really means to Louisiana.
The Affordable Care Act and all of its implications is still mind-boggling, as I have been saying for the past couple of years, but with efforts like today, we do get a grasp on what can be done and what can't be done under that federal act.
We've focused on identifying the uninsured and identifying aspects of access to care. And this year, we've created a very special task force to work toward the implementation of the Affordable Care Act in Louisiana. Our meetings are open to the public, and we welcome commentary. Well, what a difference a year makes. Since the adoption of one of the most debated laws in the history of the United States, with no less than 30 unsuccessful efforts to be repealed, ACA and the numerous lawsuits that have challenged it all the way up to the United States Supreme Court is the law of the land. And the provisions of ACA are not yet fully implemented and are staged to be implemented over time. But this year, especially this year, and the rocky road that got us this year, whether it was the technology in attempting for individuals to try to sign on to the federal exchanges or not, whether it was, what are some of the requirements, what aren't, we did nonetheless, in spite of ourselves, manage to enroll over 40 million people with health care insurance in one way or another. I'm sorry, the 40 million people who needed health care insurance, and we were able to enroll over 8 million people. That is not enough by any means, and the plan for the marketplaces to be successful is to try to enroll over 13.5 million. But we have seen, according to a recent Gallup poll study, a downward trend in the number of people who are uninsured. What we've noted is that individuals that have been eligible for entering into the new marketplaces are, with a subsidy, about 8.7 million. And the number of individuals that are eligible now for Medicaid and CHIP, who didn't even know they were eligible for Medicaid and CHIP through this expanded program, are somewhere around 6.7 million. And as of April, the deadline for enrolling, the people who actually signed on to the plan were about 8 million, which was more than, frankly, anticipated and expected, given the very rocky road to get there. Over 85% of those people chose a plan that was silver over a bronze level. And also, that was the number of people that had the largest government subsidies. According to the Kaiser Family Foundation, over 40% of the enrollees should be represented in the bracket that we like to call the invincibles, the range of 18 to 34 years of age. But 40% may be a very an important figure that we need to look to, because that's when I think premiums can begin to stabilize. Right now, only 28% of what we want to refer to as the invincibles, or in that class. So we can expect, if we can't increase the number of people in that age range, healthy people, then we'll see some increased premiums, there is no doubt. WellPoint reported nationally that 90% of its new enrollees paid at least their first month premium. Now, we're in May, so we don't know about the second month premium, but we know that the first month premium was successful, and Aetna reported that about 85% of the enrollees that signed on to a federal exchange that chose Aetna paid their first month. The Kaiser Family Foundation reported that 20% of Louisiana's state population, or about 489,000 people, would be eligible to enroll in a federal plan. But Louisiana's latest figures show, and frankly, I don't know about you, but I find this to be very optimistic and a very, very important figure, that 101,778 Louisiana residents enrolled through a federal exchange. 12,000 in Advantage, with 8,000 having paid their premiums. 250,000 would have been eligible for expanded Medicaid should the state have expanded Medicaid. So there's still a gap in coverage in the state.
Healthcare costs have been outpacing inflation for decades. According to a report by the Kaiser Family Foundation, healthcare costs are growing faster than the economy overall, and the U.S. spends substantially more on healthcare than other developed countries. 1 in 3 Americans has difficulty paying their medical bills, and U.S. government statistics indicate that the leading cause of individual bankruptcies in the United States continues to be medical bills. Obamacare was promoted as a way to address some of those rising costs, but costs continue to be a big concern as we watch to see if a fragile balance will be achieved between subsidies provided, penalties and fees charged, enrollment rates of the young invincibles, expanded coverage, and marketplace premiums will have the desired effect. One of the questions we will be looking at over the long run is, will the Affordable Care Act be affordable, not only to recipients, but also to taxpayers? We will hear an in-depth report on the impact of the Affordable Care Act on Louisiana's health insurance market later this morning. This session, the ongoing session, we are now about 2 weeks from its conclusion. We'll see some proposals that we have put forth, including health measures to give the Louisiana Department of Insurance rate review. Each year we have promoted that. We are one of the half of the states that has no authority relative to rate increases. We, under our law, don't even really get informational filings on rate increases. But Senator Gary Smith of St. Charles Parish, a Democrat, is promoting Senate Bill 554. And we also have, on the House side, House Bill 764 by Representative Kevin Pearson of St. Tammany Parish, a Republican, a measure to address the licensing of health insurance and navigators in Louisiana. As you know, navigators were designated by the federal government in the Affordable Care Act as an in-person resource to provide assistance to those shopping for a health insurance plan. We believe that the licensing and regulation of navigators is an essential part of consumer protection, especially since they have access to consumers' confidential information, including Social Security numbers, tax and banking information, and other personal information. The Navigators Bill was unanimously approved in the House, and we look forward to a similar outcome on the Senate side. In fact, last evening I was at a party and saw Senator Morrish, our Senate Insurance Committee chair, and he said in the 20 years that he's been in the legislature, he thinks this is the first time his schedule will not allow him to be with us, but sends his regards and is very supportive of that measure. Closing, let me say, as I often do, that I'd like to remind you of the resources we have available for you at the Louisiana Department of Insurance. We've updated our Consumer's Guide to Health Care booklet that includes changes to include the latest revisions necessary caused by the Affordable Care Act.
What kind of an impact has the Affordable Care Act had on Louisiana?
Well, we're not sure. We know the numbers on how many signed up through the federal website that us and 24 other states had the federal government, actually 3 other states, do the website for our state. We know those numbers. What we don't know for sure is what percentage of those had insurance before. The Gallup poll said half. Rand Corporation said 62%. Another poll said 71% already had insurance, so that the positive effect for the overall state economy and healthcare delivery system would be diminished by the larger the percentage of those who already were insured, the less positive effect the Affordable Care Act represents. But whatever it is will come to the surface eventually. We were one of the 24 states that opted not to expand Medicaid, which was part of the original concept of the Affordable Care Act, to provide insurance for more folks by making more eligible for Medicaid. Us and 24 other states decided we couldn't afford to go that far, and the Supreme Court said we didn't have to, that Congress could not mandate a state to expand its Medicaid program. And so that part, we're in league with the half of the states that said no. The subsidy, the guarantee issue, the increased age for dependent coverage, those things are applicable in our state. And the MLR, the medical loss ratio, that requires companies to spend 80 or 85% of premium dollars on health care coverage, that applies to us as well. And all of those things are so complex that opportunities like today to sit down with primarily agents as well as consumer groups and company reps to discuss the pros and cons, the challenges, the issues, the yet to be resolved issues, it's just invaluable, and I was so glad to have the opportunity once again here today.
The last year, as I'm sure all of you know, was a crazy year. It was a little bit of a roller coaster. We had a lot of last-minute guidance coming out of the federal government, and I think the results have been, hard not to say it's pretty impressive. Over 8 million people enrolled in the exchanges this past year, and more continuing to be enrolled through the special enrollment periods. And it looks like 80 to 90% of those individuals have paid those premiums going forward. About 35%, it looks like, of those individuals who are enrolled in the exchange plans are under age 35, as Donna said. 28% of those between the ages of 18 and 35, so you have some children in there as well. But this is going to be something that we need to watch going forward. Now, as a result of this and the Medicaid expansion and some other coverage expansions that have taken place, according to a recent poll by Gallup that Donna mentioned earlier, the uninsurance rate looks like it is now around 13.4% in April, which is a very significant reduction from where it was just a few months ago. So those are all good things. But we still don't know exactly what is going on under the hood, where all these coverage transitions are taking place, although we're starting to get some clues. The Rand Corporation recently released a study of changes in coverage between September of 2013, when the open enrollment period started, and today. This actually ran through late March, so the open enrollment period was still going on. Now, just a word of caution here, this is a pretty small sample size, about 2,500 people nationally, so there's probably going to be some significant error built in there, and as I said, it was going on during the open enrollment period, so it didn't capture all of the enrollment that took place during open enrollment, but we are expecting an update from them pretty shortly, which should give us some more up-to-date numbers here. There are about 199 million adults between the ages of 18 and 64, which is who this survey was looking at. And in 2013, in September of 2013, about 108 million, 109 million of those people had coverage through their employer-sponsored coverage. Another 20 million or 27 million had coverage through some other source. This would be various forms of government coverage, Medicare, Medicaid, dual eligibles, VA, military coverage. You had 12.3 million in Medicaid, which is the green bar there, and then another 9.4 million in the individual insurance market. That big gray stack to the right is the uninsured. That was 40.7 million people at the beginning of the open enrollment period. So what happened to these people? Well, most of them stayed where they were in their current form, in their current coverage. But we did have some transitions. So interestingly enough, the employer-sponsored insurance grew significantly, which is the opposite of what some people had predicted we were going to see under the Affordable Care Act. You got another probably close to 8 million, 9 million people in employer-sponsored insurance. We're not really sure exactly why this is yet, but there was some expansion of employment during this period. And then also you have a woodwork effect of the individual mandate, which is consistent with what we saw in the state of Massachusetts when they put theirs into place. Employers offer coverage because it's valuable to employees and helps them attract employees, and because there's an individual mandate, it just got even more valuable. So you had more take-up of that coverage, and then also you had more employers offering as well. And then the uninsured, significant number of those uninsured ended up in employer-sponsored coverage. You'll see the numbers of the uninsured went down by about 9 million people. And then you had, in this survey, 3.9 million adults in health insurance exchanges, most of them coming from other coverage of some sort. In some cases, retiree coverage is also included in that category. And then about 1 million from both the ranks of the uninsured and from people who had previously been in the individual market. So this is just a very preliminary glimpse as to what might be going on under the hood. We're going to have to wait for more reliable numbers down the line, but that usually takes about 2 years to really get some of that administrative data in the large federal government surveys. So we'll probably see those sometime 2015, 2016 to get a lot more detailed and reliable numbers. How about premiums? Well, I can tell you this, premiums will go up. Premiums have always gone up. They will continue to go up. The question is, how much will they go up and why? One issue, again, this demographics. What does this enrolled population look like? Not just in the exchange, but also in the individual market outside the exchange, which the exchange is all pooled together with in the single risk pool. What is the influence of grandfathered plans and the transitional plans? These are plans that exist outside of the single risk pool. So if you have a lot of young, healthy people staying in grandfathered and transitional plans, then that's going to impact who's left in the risk pool for the exchange and the individual market and potentially driving up costs. That's something we're looking at very closely. We probably won't have real good numbers on that until early next year sometime when some of those filings start to come into the federal government, but states may be requesting that information on their own. Obviously, the market rules are going to have an impact on premiums. Anytime you compress rates through community rating, through the age bands that we have, going into place, it's going to impact rates, and it's going to impact rates for some people differently than others. And this is all going to shake out over the next, it's going to take longer than just this year. It'll take a couple of years probably for us to get a real sense as to what's going on there. The premium taxes. There's a premium tax going into place on the federal side that's going to amount to somewhere between 1.5% and 2% of premium probably. That's ultimately going to find its way into the premiums that consumers pay. And then that escalates over time under the ACA. For the next several years, it increases and then goes with an inflationary index. What are the administrative costs going to be? There's a lot of new regulations going into place. Those have to be complied with. There's new reporting that has to be carried out by the insurers. That all has to be paid for, and it has to be paid for within the context of the medical loss ratio that restricts their administrative costs to 20% of premium, or in the large group market, 15% of premium. And along the same veins, the enrollment and payment issues that we saw during the open enrollment period. There were a lot of manual workarounds that insurance companies had to engage in that open enrollment period to make sure people got in their plans, to make sure that they're getting the right subsidies from the federal government, and all that takes increased resources from the insurance company. That also is going to find its way into the premiums. How much is that going to be? We don't know yet, but I guarantee we're going to find out. And then the risk mitigation programs. Congress foresaw some of these issues when they passed the law. So they put a couple of programs into place, the risk adjustment to prevent any one carrier from getting a disproportionate share of the healthy risk or a disproportionate share of the sick risk, and evens that out a little bit. A reinsurance program to subsidize the individual market during this transitional period, and then a risk corridor program that basically caps gains and losses for the first couple of years in order to give insurers a little more comfort in their pricing, given the lack of data that we have on the health condition of the people who are entering the individual market now under the new rules. So these are all things that are going to shake out. Some of it will be reflected in the rate filings that are going to be coming in just a couple of months, or in some states have already started coming in based on just a couple of months of data. And that's going to be something that we're going to keep our eye on. So looking forward, what do we see coming in 2015? Well, we've got the plan management cycle for the 2015 plan year. Seems like we just finished, and we did just finish, with the 2014 open enrollment, and state insurance departments are already accepting filings for 2015. Again, based on just a few months of data in terms of what's going on in the marketplace. There's some new rules going into place for qualified health plans that I'll get to, as well as new functionality in the shop exchange, the employee choice, which was postponed for a year. You've got changes in the employer mandate, that beginning to phase in, as well as changes in the individual mandate penalties and the reinsurance program. That's a backstop for the individual market. And of course, more court cases coming down the pipe, probably headed to the Supreme Court. And in November, we've got an election coming up. How's that going to impact things?
What kind of an impact has the Affordable Care Act had on health insurance throughout the United States?
Well, I think it's kind of a mixed bag. For a lot of people, especially those who are older and have health care conditions, it's been a great thing. It's really helped them get coverage where that wasn't available in the past. But for other younger people, it's caused some complications. It's made premiums more expensive, as they're now subsidizing some of the cost of the older and sicker individuals. So it really depends on who you are and where you live.
What would you like to see Congress do in this area?
I think there's some technical fixes that Congress could make. There are a number of areas where the bill could be improved, particularly since the bill was never really supposed to become law in its current form. If you recall, when they were considering the bill, Senator Ted Kennedy passed away, and his seat was then won by a Republican, making it much more difficult to get changes made to the legislation, so they passed it as is. And the partisan divisiveness over the past several years has made that more difficult to do since the law passed. So hopefully, moving forward, Congress can do some technical fixes, change some things that were never really intended to be put into place the way they are.
I'll start with the generally accepted concept that our current system, as as it existed pre-Affordable Care Act was unsustainable. And I refer folks when I make speeches to no less a conservative than Newt Gingrich when he was Speaker, John McCain when he was nominee, Mitt Romney when he was nominee, all of whom in agreement agreed that the current system is not affordable, that we can't continue down the road we have been on. The Affordable Care Act anticipated, in order to address the disproportionate or extraordinarily large number, in particular in a state like ours, where about 800,000 of our residents are uninsured, about 20%, a little under 20% of our state's population. It has stayed at that level for decades. Back when I was a legislator, we were trying to encourage, cajole, do whatever we could to get folks to even sign up for Medicaid, those who were eligible. So with that said, that became a part of the Affordable Care Act and became a part of the decision the U.S. Supreme Court rendered on the constitutionality of the Affordable Care Act. That decision had two major parts to it. Number one, the big debate at the core of whether it was constitutional or not revolved around was it a tax or was it a penalty? And the administration went back and forth. It was a tax in the court, but it had been a penalty in the political process in getting it passed. That went back and forth, and by a 5-4 decision, the U.S. Supreme Court said it is a tax, and the Congress has the power, historically and constitutionally, to levy taxes. But, they went on to say, the Congress does not have the power to force states to accept a federal program like the expansion of Medicaid. And about half the states, I think 25 or 26, did what Louisiana did and said no to expansion of their Medicaid. And that left nationally a big hole in the numbers that the administration was anticipating would get coverage, quote unquote, through the Affordable Care Act. That expansion, those additional folks who would be eligible for Medicaid and would access Medicaid as a result. So I just share all that by way of background to most of the people at the table knew all that already, and many of you in the audience did, and I apologize for boring you with that overview. But some do not, and I just wanted to share that with the rest of the audience.
Louisiana long ago opted to have a federally facilitated marketplace. I think a decision that has, by and large, panned out as a wise one from the governor's perspective, as we've watched a great deal of variety in terms of the success and the rollout of these exchanges, both at the state and the federal level. And I think when you look at the numbers, it's important to see that of the 184,000 that actually went online and were determined eligible to enroll, only about 102,000 actually selected a health plan. And then when we look at what the enrollment in Medicaid looks like, through the federally facilitated marketplace, there have been a little over 14,000 Louisiana residents that the marketplace deemed eligible for Medicaid. And that's because Louisiana opted to be a determination state where the marketplace had the ability to determine an individual eligible for Medicaid based on Louisiana's eligibility standards. That sounds like a lot, but when you actually look at it, at our 12-month enrollment trend going from April 2013 to April 2014, we've actually seen a slight downward tick in Medicaid enrollment, 0.72%. And I think that there are a few factors that are contributing to that. I think that there were some eligibility criteria revisions that were put in place at the beginning of the year to coincide with the availability of the new coverage to the exchange. I think the economy is generally improving, and with that we usually see a countercyclical impact to enrollment in public assistance programs.